I'm Dr. Juarez, and today we had a 31-year-old female present to the clinic for symptoms of a sore throat, fever, and diarrhea persisting for about 2 weeks. And upon doing multiple workups and getting some blood work done, we did see that she had a positive ELISA test, which is a test we do to verify for HIV. We will have to send it in and have her do a Western blot test following that, just so we can confirm the test, but it looks like she is positive, and we will be giving her some education on it today.
I just found out I have HIV. What does this mean for me? Do I have AIDS?
Hi Molly.
Hi.
I understand you just had a HIV diagnosis and you want to know what it means for you.
Right.
HIV stands for Human Immunodeficiency Virus. It is a retrovirus that attacks your immune system. You do not have AIDS.
Okay.
It is usually transmitted through bodily fluids. Blood, most of the time blood. If you share needles with someone, if you're having sex, anal sex, vaginal sex, or it can also be passed down by the placenta of a mother. But typically it's just destroys the immune cells, the CD4 cells that our body makes, and it makes those cells vulnerable to get attacked by this HIV virus. And it can't fight off, your body can't fight off organisms and normal things that it would normally be able to fight, like a common cold, or if you got sick, you would get a lot sicker because of this virus. Some risk factors of this, like I was saying, is having unprotected anal or vaginal sex, sharing contaminated needles, or any sharing of equipment of needles with HIV infected person, perinatal transmission during pregnancy, childbirth, breastfeeding, or if you have unsafe blood transfusions, any tissue transfusions, or procedures that you may have had that may be unsterile in a doctor's office, or getting any tattoos or piercings you may have had, or having accidental injuries, like by getting cut by something that was infected. Do you recall anything like that happening to you? With any accidents?
No, not that I can think of.
Okay. So it's, and you're sexually active? Okay, so it's a possibility you may have contracted this during sex.
Yeah.
Okay. Does that explain your question? Okay,
Yeah.
thank you.
Thank you.
Hi Molly, I'm Cheyenne and I'm a nurse here at the clinic. I was asked to come and speak to you about some medications and treatments that you may be taking for your diagnosis. So as you know, HIV has no cure, but strict adherence to the antiretroviral therapy, also known as ART, is going to dramatically slow the disease's progression for you. So the main goal of these medications is going to be to control the growth of the virus, to improve how well the immune system is working, to slow and control your symptoms, and to prevent transmission of HIV to other people. The FDA has currently approved more than 24 antiretroviral medications that are broken into 6 categories, and that's based on how they work in the body. So NRTIs, or nucleotide reverse transcriptase inhibitors, are medications that force the HIV virus to use faulty versions of the building blocks, so infected cells can't make any more HIV. You may be placed on an RTI, which is a non-nucleoside reverse transcriptase inhibitor, which is going to bind to a specific protein so that the HIV virus can't make more copies of itself. Protease inhibitors, which block a protein that infects cells that they need to put together a new HIV virus particle. Integrase inhibitors stop HIV from making copies of itself by blocking a key protein that allows the virus to put its DNA into healthy cells' DNAs. Fusion inhibitors block HIV from getting into healthy cells. So if none of these other medications work, there is a medication called a GP120 attachment inhibitor. It's a new class of drug that consists of a single med and it's for individuals who've tried other medications and they had resistance to those medications. It targets the glycoproteins on the surface of the virus, and it stops it from those CD4 and T cells getting infected within the immune system. Doctors usually recommend that you take a combination of at least 2 of these medications, but a lot of the time they can combine them into a single pill, so you don't have to take a bunch of different pills. Directions should be followed exactly, and you shouldn't miss a dose. If you miss a dose, you can develop a drug-resistant strain of HIV, and those medications may no longer work for you. If you have a partner, they may also want to consider taking PrEP, which is a pre-exposure prophylaxis. It's a medication that can help protect them from exposure or infection. Other treatments that you want to do in lieu of these medications would be to stop smoking, maybe consider some weight loss, exercising, eating a high protein diet, treating any infections you have promptly, and staying hydrated. Also, you're going to want to get your viral load tested every 4 to 8 weeks until you have a suppressed immune system, and then every 3 to 4 months after that.
Okay, so given all the information that we've given you today, are you able to tell me anything that you have learned today?
Yes, it's just been a lot, so I just want to make sure the signs and the symptoms that I've been experiencing, like fever, sore throat, I'm really tired, I have diarrhea sometimes, is this gonna worsen over time?
It shouldn't, now that we do have a diagnosis and we will have it confirmed, but as soon as you start your regimen, all of these symptoms should subside. But
So I won't feel like this forever?
no, you won't. This is something that can be fairly treated, just like high blood pressure. It's not something that you're just gonna have and feel worse and worse. So you will feel better, you will be treated.
Okay.
Can you kind of read back to me the sections on asymptomatic and symptomatic?
Yes, so I know that if I'm asymptomatic, I won't be having any symptoms, and if I do, they're gonna be limited. I might not even feel any symptoms at all, but I know that I'm still positive, I know I'm still infectious, and to be careful. And if I'm symptomatic, I will have the symptoms that I'm having now, the flu-like symptoms, but worse. I can even develop thrush, I'll have chronic diarrhea, night sweats, my headaches will become more frequent, and as well as the fatigue. And I know to call my physician or go into the emergency room.
Right. And another thing is you can take cold medicine for those symptoms as well. So
Okay.
a lot of people aren't sure if they can, so you can.
Okay.
Hi, Molly. Hi. I'm the nurse, Jackie. I'm here to talk to you about your diagnosis. How are
Okay,
you?
thank you. I'm okay.
Yes, I know it's probably a very difficult time right now. The doctor did come in and inform you that you were HIV positive, and I assume that you probably have a bunch of questions right now.
Right.
So I did bring in some brochures. I wanted to kind of go over them with you.
Okay.
So the first thing I wanted to go over with you is just some recommended lifestyle changes. There's probably going to be a lot of questions you have, so feel free to stop me if you want me to go over anything else, okay?
Okay.
So of course you just were tested positive. It's important to establish care with a primary care provider. I don't know if you want to stay with this provider or if you want to establish with another provider that specializes in HIV. But establishing care is very important, so that way you can just follow up with them with labs and medication and everything, okay?
Okay.
Another very important thing is to start your antiretroviral therapy as soon as possible. Your medication regimen will be very helpful in suppressing the viral load. And as you can see in your brochure, it also prevents drug resistance and opportunistic infections. It decreases the risk of spreading the virus and developing AIDS. It's important to remember that undetectable equals untransmittable. So if your viral load is below 200, you are less likely to transmit the disease or the virus. And until it's undetectable, it's important to practice safe sex with your partner. And if you are using any needles, it's important to disclose that information to any of the people that you're using needles with, or not use needles with anybody else.
Okay.
And other lifestyle changes, if you want to go over them in your brochure, eating a healthy, nutritious diet. This helps to fight off symptoms of HIV and improve absorption of the medications. Exercising regularly, this helps to improve the body's immune system and fight off the infection. And smoking cessation is also very important. Are you a current smoker?
No, I'm not.
Okay, good. Just in case you wanted to start smoking, because this is a very stressful time, I encourage you not to smoke.
Okay.
And that's because HIV weakens the immune system, and smoking increases the risk of developing cancers, such as pneumonia, and having a poor response to the medication and overall causes a shorter lifespan. Some family teaching points I also wanted to go over with you. Untreated HIV can progress to AIDS and severely damage the immune system. So again, it's important to stick to your HIV regimen. Follow up with your physician and to get your viral load blood test as ordered by your physician. A weakened immune system increases the risk for opportunistic infections. Some of these include pneumocystitis, pneumonia, tuberculosis, and toxoplasmosis. So some of these signs and symptoms of the infections that I want you to be aware of and of course share with your family so they can be aware of are chills, fever, sweats, weakness, weight loss, chronic diarrhea, skin rashes, bumps, spots or lesions around the tongue, and swollen lymph nodes, okay? So just try to kind of keep an eye on those signs and symptoms. In case you have any of those, please call your doctor immediately. This will help to determine if you need to be hospitalized, and if you don't need to be hospitalized, the doctor will let you know how you can treat those symptoms at home, okay? So if it's not required to be hospitalized, usually cold and flu symptoms can be treated by over-the-counter medications, and as well as maintaining adequate food, rest, and don't stop your HIV medications at all, okay?
Okay.
Other things you probably want to talk to your doctor about before you do is taking any vaccines. So there's certain vaccines that are called live vaccines that can be a little bit more detrimental to patients with HIV. So make sure you talk to your doctor before you take any vaccines, okay? Another thing that's probably going to be very difficult to share is your HIV results with your family and your partner. So I just want you to know that it is a very difficult topic, but it's also very important that you do share this information, especially with your partner. By sharing this information, you're opening that communication line with them, and you guys can both make better decisions for your health. So your health outcome for both of you will be a lot better, okay? And if you do need any additional help with sharing your information or anything like that, please let us know. We have multiple resources available here and in the community, so we can get help with that, okay? Okay. And then one more thing I wanted to talk to you about. Do you currently have any children?
Yes, I do.
Okay, great. How old are they?
They are 2 and 4.
Oh, how cute. Are you planning to get pregnant anytime soon?
No.
Okay. So if you do plan to get pregnant, it's important to discuss that with your doctor as well, because HIV can be transmitted to your baby, and it says on here on the brochure, it can be transmitted during pregnancy, birth, or during breastfeeding. But lowering your viral load will also help to decrease that transmission, okay? So it's important to, again, practice safe sex measures, but talk to your provider if you do become pregnant.
Okay.
Do you have any questions for me?
No, I don't. Thank you so much, Jackie.
Of course.